Hello, I am Victoria with Hope Service Dogs, and with me is Jamie.
Hey.
Otherwise known as James. And he has been, I've known him for close to a year. In like a week and a half, it'll be a whole year. He came up to our workshop last January, our Cultivating Confidence workshop, and was very interested, and he's been coming back since then. So Ollie is his dog, which is Lucy's baby daddy. All right, so he's going to be a grandpa soon.
Will be.
Yeah. And we wanted to talk today while we're waiting. We're back waiting for the mamas to go into labor and have puppies. We were talking about scent-based service dog task training and figured we would record on it, talking about it, answering questions on it, and then we can share that knowledge with all y'all. Right? So that's what this is. If you guys do have any questions, if you're catching this live on Facebook, let us know what the questions are, and hopefully we can answer them. But if you're listening to this afterwards, a lot of the podcasts, you can get a hold of us or hopeservicedogs.org and let us know what your questions are, and maybe we can answer those next time. So, scent-based service dog tasks, right? Think diabetic alert dog. That's scent-based. We know that's scent-based. There's other ones like seizure alert or PTSD or POTS that we don't know if they're scent or sight-based. And what that means is the dog figuring it out through their nose, which is way better than our nose, or by what you're doing, what physical thing you're putting off. You know, are you going super pale? Are you freezing up? Are your pupils dilating? Like, I don't know. And that's a big thing too. I don't know.
And that was my question to Vicky is you know, when do you differentiate between the scent versus the actual just physical things that the person's doing? So we're going to hopefully get into that.
Yeah. And we aim for both, right? I like to ask people, you know, we've had people who have PTSD or people who have seizures that aren't epileptic seizures, right? Maybe they're PTSD-induced seizures, and they tell me that they have seizures and they want to do scent-based. I don't know if that's scent or sight. I'm not a dog. I don't know. I don't think there's been any studies on it. And if so, I haven't seen them. So if you know of any studies that have been done on it, let me know, because I'd be very interested in knowing. But we train for both. And then what do we use? Is it saliva, which is spit? Is it sweat? Is it blood? It's not blood, usually. It's spit and sweat. So we're going to show you how to collect samples, how we prep the dogs and all that. But we do train for both. I've had people with my POTS, you know, friends and stuff, once they get to know me, they'll look at me and they'll say, "You feeling okay?" And sometimes I'm like, "Yeah, I'm feeling fine." And then a few minutes later, I'm like, "I don't feel good." So there is a sight base to it. Is the dog noticing what you're doing? Because they're more keyed in with you. So we do like to train a very nice focus from the dog. So they are focusing on you, paying attention to you, you know, and they've got it so they can pick it up. If I'm having a wonky time, I'll call the dog over, I'll breathe on them. But we start introducing scent, deliberate introduction of scent to the puppies at 3 days old. Before eyes open, before ears open, we give them, you know, a day to recover from delivery, or 2 days to recover from delivery. And then we start with the early neurological stimulation and the early scent introduction. And as we have these litters, we'll share that with you. We usually do. We put it up on TikTok. We'll cross-post it on our Insta, on Facebook, on YouTube. So make sure that you watch for that too, because it's really interesting. And I'm not going to say it's one of the things that sets us apart from other breeders, but since we were trainers first, service dog trainers first, I knew what I wanted from a puppy I would get. And oftentimes our pups excel more than the dogs who would come in from dogs outside of our breeding program. See, I saved that one.
Yeah.
I didn't know how I was going to phrase this nicely, but you know, like they're more successful at it because it's something that we nurture from the time that they're 3 days old.
Yes, and in terms of, I've been, like you said, I've been here about a year now, and I've seen about 2, I think maybe 3 of the litters and doing the early neurological stimulations, and that scent comes in right at the beginning.
It does. It's so cool.
Yeah.
Do you have a favorite scent that we've used so far?
Well, the one I'm most familiar with and working with the dogs here is birch, right?
Yeah.
That's the one that that's the novice type of scent. So I guess it's one that what they start off with typically.
Yeah, if you're going to do AKC scent work, so Ollie's working towards his scent work titles, and Bert's working towards his scent work titles, and the first scent that they do in Novice, here's Lucy, the first scent they do in Novice is Verge. So, you know, we'll introduce that. We'll also introduce the Nosy Nose pillows that we'll get to and show you guys. We'll use those with the puppies. We were using them yesterday, today, the last few days. We'll work scent focus for a little bit, and then we'll pull off and do a different focus and kind of give them time to absorb what we were just working on, which, for example, has been scent, while we maybe pull in something new, and then we can add both of them. And then we'll pull in something else new, because it's a lot that we have to teach these pups. And while we have 2 years to get them where they're a fully trained service dog, learning is never done. So Ollie's closing in on 3.
Yeah.
In what, April?
Yep.
In April, he's going to be 3, and he has, 2 legs towards his interior and his exterior?
He does, yeah. We're hoping to close that out
this month.
Within this month, yeah. So.
And then work towards his elite and get him started with advanced and with the others, container and buried.
Yeah. Yep.
See how he does with all that. And why is to help prove them as service dogs, right? Bert, I don't need a scent alert for the POTS because I feel cruddy a lot of the time. You know, it is nice if I am out for him to say like, hey, you might want to sit down and not do that right now because you don't feel good. So we'll do it. A lot of people want it. And it's similar, right? So the POTS, scent-based seizures, scent-based diabetic alert is all trained similarly. And it starts at 3 days old, right? It starts there. Well, but I have a dog and my breeder didn't do that. We do. Or I have a dog who's a year and I'm just getting started. It's going to be harder for you, right? Because the dogs are very plastic at 3 days old. You know, we can mold, we can shape, we can encourage different things. We were talking about having them, you know, fight for the nip a little bit, you know, to build that drive and that love for it. So we're able to do a lot because we breed here, which is really awesome.
Yes. So how do you want to go forward with talking about the puppy side of it or going into the actual task training? What
would you like to do? Do you have a preference? Because we can hit both of them at different times.
Yeah, I guess my questions kind of boil down to, I'm familiar with a lot of the tools, and I think a lot of viewers are, the tools that we use, right, for nose work are, you know, this is the Nosy Nose. That's the one you mentioned might be the
I like Nosy Nose.
Yeah.
And why is it's this little kit you can get Amazon, Etsy. I believe they have their own website now also. And they look like little pillows that Barbie would use. Like they're about that size. But the little pups that we have now are 3 months old, right? So as we're playing with them, we can hold it in our hand. Well, they know the 2-finger touch. So we hold it in our hand, they come over and they smell it. And we can hold it in this hand. What if it's in a closed hand and it's just in one of them? Can you figure out what the difference is? Why are you getting a reward for going to the one with the pillow in it versus the one without the pillow in it? What if I tuck it underneath my leg or in my sock? What if it's here on the shelf beside me and not on me? Can you find it there? Now for allergen detection dogs, the scent is going to be in the environment. It's not going to be on you. For a lot of the other medical alert dogs, the scent is on you, right? Diabetic, it's on you. POTS, it's on you. It's not going to be that you have to warn me that there's peanut butter on the handle of that door. Because I smell it, I'll touch it, I'll go into anaphylactic shock and die, right? So what you're going to need is going to be a little bit different. I don't do a lot of food allergen ones. I'm busy with the POTS. I'm busy with the puppies. I don't do a lot of food allergen detection dogs. And that you really have to be careful and you have to proof up the wazoo, right? Your dog can't be walking through a restaurant and say, hey, that table has gluten, that table has gluten, that table has gluten. It has to be a specific thing. Here's a plate. Does it have gluten on it? You know, and see. But what happens if you're out and you don't have your magic plate? Because you have to train for everything, right? And you have to be prepared. But I do a lot with the others, right? So if you're going to say, well, how would you train, Peanut? I don't do that. Like, I can give you, like, this is what I would do.
Yeah.
But I don't. I do a lot with the scent and the sight. So we'll work a lot with focus on me. And that isn't this, where you draw your hands from the dog up to your forehead in the shape of an L on your forehead. Yeah. No, wasn't that a song?
Yes.
We don't do that, right? But if the dog offers it and I catch the dog looking at me, even if I have to get the dog to look at me, I can click and reward. And the dog understands that the click means get out of behavior, that ends the behavior, marks and ends it, and then go over and get the food, and then they can come back to me and look at me. And I can click and I can reward over here. If I'm just marking and feeding the dog right into their mouth while they're looking at me and they're still looking at me, that's not hitting the same thing. That can go for duration, right? The other one is for that finding you. So I do that a lot. I'm very good at getting focus from a dog. It's really, especially when we start them so young.
Yes, yes.
Some of the older dogs would come in. Jamie, we had one dog who would come in. It was a Doberman. And the Doberman would not look at you.
Oh, yeah?
She would look, and then she'd go up and around you, and she'd continue looking.
Oh, yeah.
But she would not look at
Because
people.
it could be a form of aggression. Like,
Yeah.
yes.
She was very, I hate using the word shut down, but
Yeah.
she was.
Yeah.
So for that dog, getting her to look, in the beginning it was look at my knees, right? And we'll reward that.
Yeah.
And, that even if you brought a whole hot dog up to your eyes, she was still not going to
Right,
look at you in the
right.
beginning. But, you can gauge it.
Yes.
So again, that's why it's nice to start with the breeder who knows what they're doing.
Right.
And starts out well. So we want that focus for the sight base. We want the scent stuff. We work with this and the pillows, and it comes with refills. So if you're on here, you can see this is the scent refill. There's some corn cob in here, corn cob bedding, and scent. What is it, anise?
I think it is, yeah.
I never remember.
Anise, yeah. Yeah.
So anise is not birch, but we just said we like birch. We use different ones, right? We'll also use for the puppies, for the newborns. We've had people send us like pine, because they have pine trees in their yard. We've had people send cotton rounds with horse on it. Like they have a horse, so they'll go out and they'll rub the cotton round on the horse and they'll send it to us. Or cat, or rabbit, or guinea pig, or like whatever, chicken feathers. So like we'll get different things and see the puppy's reactions to some of them. Some of them are like, oh, I really like that. And they'll go towards it, like sniffing up a storm. Some of them will just act like there's nothing there. And some of them will pull away.
Yep. Like
it's the worst thing ever.
Yes.
And I'm trying to remember what it is. Maybe lemon juice. When we do that, they're always like, whoo.
Yeah.
But, and we'll track it on what it is. So we know, we do have the cat out there. If we catch them, we can.
Yeah, absolutely.
We used to have the chickens. We have the goats. So we've got some of those scents. We'll use, I like lavender.
Yeah.
It's calming. It's soothing. It smells good.
Yep. And you were getting into the capturing aspect of it, where if you find a dog that has a certain, like he's caught a scent or she's caught a scent, maybe it is like a chicken feather on the ground or something, you could reward that. The reason I picked this one up first is because this is just so easy to quickly and easily train a dog. Starting from a young puppy, you can just hide this like we talked about. And if you're in an apartment, maybe you don't have access to all these smells that we have on the farm, but you can just buy this and then get your dog started. And what this can lead into is what I wanted to talk more about is the actual tasking off of scents and how you can transfer your dog from maybe this into actual task work off of you.
Perfect. Yes. So what this teaches at 3 days old, right? We're teaching that scent has meaning. And a lot of times, maybe you have candles going in your house all the time and you have plug-in air fresheners and maybe you smoke or someone comes around who smokes or you're not diligent about that and you use a bunch of Axe body spray, right? And your dog is overwhelmed by these scents and learns to ignore their nose. So what we do is we teach the dogs that scent has meaning and understanding that. So they're little, right? They're little guinea pig potatoes when they're born. While we're doing it, especially if I'm not feeling good, I'll put one on me and I'll just breathe on them. Sometimes they burrow. They're allowed to burrow. They can lick, right? So if they're licking, especially if they're licking where you sweat, like awesome. Like if they're licking my clothes, it's a little weird. So maybe I'll pull up my sleeve and they can lick my arm. So we'll work with that with them, that scent has meaning. And when you smell this, good things happen. So I'll always give them love and attention, like that's a good puppy. It didn't happen yesterday, but we had the 3 3-month-olds, Bert puppies at the park, Bert and Figment. So we had 5 dogs, 5 service dogs in training at the park yesterday at Universal. And we'd find some hidey holes and we'd go over and we'd work the dogs. I wasn't feeling great, so I laid down and Bert was there, and then Figment came crashing over because she knew. She's like, I can do this. I know what's needed, but often what we'll do, especially if we have puppies who we know are going to people who have POTS, is they'll just start bringing me puppies, or I'll say, bring me, whomever, bring me, Fido, and get Fido over here, and I'll love on Fido and teach the dog that when you smell this is what I want you to do. I want you to go into deep pressure therapy across my lap. If I'm lying down, I want you to be across me or to be beside me. This scent means something. And because we're not ignoring it, we're not like, oh no, it's nothing. Because the dog, we limit the scents in the house. Like, we don't use air fresheners. I do have some candles. We don't burn them all the time. We usually don't have plugins going because we don't want to ruin scent. We don't allow smokers, they're not around smokers. It can't, they can't, because it'll kill that nose on them. So if somebody, this is one thing, I don't know if I told you or not, if somebody's diabetic and they want a diabetic alert dog from you or something scent based, but there is a smoker in the home, I won't do it.
Oh, that's
because you can't.
Yeah.
You're going to kill the dog's nose.
Yeah, that makes sense.
So it's something that, like my mom, I remember, oh my gosh, from an early age when they were smoking in non-smoking parts of the restaurant and everything, and sometimes there was not and it was all smoking, we wouldn't go there because she was very anal about being around that smell, that smoke.
Sure, yeah.
And it
makes sense because it covers up everything. So
and it coats. Yeah, exactly. It covers up, it coats. And it'll ruin what you can do. So we teach them, like I said, that scent has meaning. Oftentimes, these pups are 3 months old now. I haven't used scent samples for myself, but I'll use myself as a live sample. I don't think any of them are diabetic. I think they're all POTS if they're scent based. But even if they were diabetic, I don't need the scent samples yet from the owner. I can use this and just work on exercising their nose. People are always very much in a hurry to get to that final scent.
Right.
But I want him for diabetic alert. So here's my scent samples that I've collected, which we'll get to how to collect those. Here it is. I don't want that. I don't need that yet.
Yeah.
And I really don't, because if you screw it up,
yeah.
And the dog's like, I hate the smell of anise and nosy nose. I don't care, because I can pull out birch. I can pull out lavender. I can pull out vanilla. I can pull out so many different scents that we can do. If the dog doesn't like the diabetic scent, you're screwed.
In trouble. Yeah.
So it's like doing the reps in cross training. I used to play basketball, but I'm not big on the whole worky outty thing, but I know football players don't just play football, right? They'll go and they'll run and they'll go and they'll do weights and they'll, do different things because it all builds and works together.
Yeah,
and so,
remember the 2-a-days? That's football. But yeah, we do different sessions with the pup.
Yeah. So we'll get it and see where they excel at. And it's really neat because from 3 days old to, when someone can go home at 8 weeks old or 6 months old, we're always doing scent here and there with them. My mom is diabetic. If my mom's over and she's not feeling good, I might pop a puppy on her. Why people don't always want to come over to my house. I'm going to pop a puppy on you if you don't feel good. And see what you do. I don't want the puppy to smell me when I'm potsy and to get all crazy and want to bite at it. So that's where, you're on me. It's nice. We're going to stroke the puppy nicely and pat him. And it's all going to be good.
Yeah.
But I'm also not walking around where I could pass out with the puppy.
Sure. I'm
sitting down or I'm reclined or I'm lying flat, Yeah. So we get that. And then as we're doing good with this and they're finding the nosy nose, is there maybe introducing a second smell, then we can often come in with the smell, with the scent sample, and teach the dog the same way, but it's easier. And you'll notice with Bert, right? With the scent stuff, it was birch, and then it was anise, and now we're starting to introduce some clove, and we just kind of take it back, but we don't have to spend as much time with the foundation.
Yeah, he's kind of got it. Yeah.
Yep. And what some people will do is they'll cocktail the scents.
Yeah.
So, and what that means if we're going to do the AKC stuff is instead of doing birch and anise and clove separately, they'll put the three of them together.
Yeah.
And I've heard good about that, and I've heard bad about that.
Yes.
So good about that is If you can smell a stew, you can pick out the peas and the corn and the potatoes. But can you really? Like, again, I'm not a dog. I don't know what a dog smells. I know it's better than what we smell.
Yeah.
I don't know what it is. Like, when you come into the house and it's Thanksgiving, you can be, oh, that smells so good. That smells like Thanksgiving. But that's the sweet potatoes, but that's a different recipe this year. Like, I don't do that.
Right.
I don't know, but my nose isn't dog nose.
Exactly. Yeah. And I remember in dog training in school, they would tell us that with the police dogs, at the very end, they would do the mixture.
The cocktail.
Yeah, the cocktail. With the drugs, right? The different types of drugs that they'd have to go after. But that was like the final type of test. Like, if you can differentiate, what's in this stew, that type of thing. Find the one drug that's in with other smells, like maybe these that aren't drugs.
Yeah.
It's important. And I think it's probably the same with service dogs, right? Because they got to pick out specific scents in a big mixture of scents that are going on around them.
Very true. And they have to, like, it's the gluten on that table versus the gluten on my plate.
Exactly.
I need to know it's just this one that I care about.
Yeah.
If it's potsy, believe it or not, a lot of people who come here have POTS. And so the dogs can technically, like, they could probably alert to everybody. And we've seen it. Like, it happens. Same thing with diabetic. Yeah. We've had diabetic alert dogs out in training, and they'll alert to somebody behind us. I remember it happened that we were watching the Fantasmic at Disney Studios, and, like, the dog would not leave this person alone. The dog was trained as a diabetic alert dog. And I turn and as I'm talking to him, because I don't often talk to people when we're out. That's Rich's job. It's not my job. And he was diabetic, and he had been at the park all day, and he hadn't checked his blood sugar. And he, when you're exercising, like walking the park all day, it will affect, and then you're eating maybe crap food, or maybe you're really trying to watch it, but you're still getting all this extra exercise. And so he said, I hadn't checked my blood sugar today. He hadn't even thought about it. So he went and checked it. I think he went to the bathroom first from privacy, so he's not like jabbing his finger before Fantasmic started, and came back, and he's like, yeah, my sugar was off.
So the dog was doing it.
So the dog was doing what he was supposed to be doing. And what if we were like, no, that doesn't mean anything.
Right.
Like, we could screw it up. But it was also a younger pup. So, like, on a finished service dog, I wouldn't expect my finished service dog to go out and do that, because I am your focus. Yeah. But to each his own. Yeah. They'll figure it out. A service dog should still work for one person, but I don't have a problem if he's like, hey, you two, check it. Yeah. What else you got?
We were also talking about not only, I guess it may have to do with scent, but, like, how do you know, really, and I think we kind of touched on it, that we may or may not know, but there's certain tasks, like blood, some people want it for blood pressure. I don't know if that's, is that a hearing thing? Is that a scent thing? How could you possibly teach a dog blood pressure?
Yeah, that, and I've heard it referred to, because I'll get people all the time who apply or who ask me questions on training, and they'll say, like, I need a cardiac alert dog. Yeah. But they won't put on there that they have POTS or dysautonomia or anything. Right. So I'll ask them to clarify, like, cardiac alert for what? Right. Rich's dad had multiple heart attacks. Like, I don't know if there's heart attack alert dogs, but that's what my mind goes to if you're going to say I want a cardiac alert dog, is heart attack. Yeah. Not a POTS alert, because I don't know what that is. Right. And one of the bad things about Apple Watches is because it does have I don't have mine on today for some reason, but because it does have the pulse rate, people will see that their pulse rate got high. Yes. Well, it can happen. Your pulse rate goes up. Yeah. What is it, like 220 minus your age was supposed to be your ideal heart rate? I think. Isn't that what they taught us in health class?
But yeah, it'll go off.
So, like, it'll go up there, but it's the fact mine can get up there, especially if I'm not on meds. It can get up there pretty high while I'm sitting doing nothing. Yeah. But I don't get the benefits of having an elevated heart rate for 10 minutes like you're supposed to, because you're in prime. Right. So it's not good. I don't know what the dog hears. Like, that was my tangent. But I don't know if the dog can say, like, I hear that his blood pressure is really wonky. It's not 120/80, it's 170/50. Like, I don't think that's what's going on. I don't know. Like, or are you putting off a scent or a hormone? Or
just the way you're acting may be different, or it could be that you're just sluggish, or whatever the case may be. I find it interesting, what the dog can do is kind of broken into different senses, right? And we still don't truly understand how the dog is, getting the task off of us in certain senses, certain regards, certain tasks.
Oh, totally. I've had people, I remember one person told me, or I heard, that they were states away from their dog. States away.
Yeah.
Right? Not like, the border to the states in my backyard, but like multiple states away. And the dog was alerting, and so the mom calls up because the dog was at home with the mom and says, hey kid, how you doing? Check your whatever because your dog's alerting.
That's crazy. Yeah.
And they checked it, and oh my God, it was whatever.
Yeah.
And I'm like, that's not scent-based, that's time-based. So, when you get home from school,
Very true. Yeah.
right, and you'd be hungry and you get a snack.
Yep.
Because you're eating lunch at 10 o'clock in the morning.
Yep.
So you get home at 3 o'clock in the afternoon, you're hungry, you get a snack. Every day. So what happens whenever you come home? Maybe your dog's like, hey, your sugar's a little bit low, you need that snack. Mm-hmm. Okay. Now it's 3 o'clock in the afternoon, you didn't come home, but your dog's still like, hey,
yeah, it's time.
I'm supposed to alert somebody about something going on here?
Yep.
Oh, it is low. Well, it's low because it's just the time of day that it should be. We've got to be practical about these things too, right? Your dog's not smelling you, maybe across the room, depending on competing scents and what's going on, and they can still see you from across the room. Mm-hmm. But if my dog's outside and I have all the windows and doors shut and I'm inside, my dog can't alert to me. He can't see me, he can't smell me. Like if he is, it's a time thing. He doesn't feel the connection between us and know that I need him.
I think he does. A little bit.
Just because you and Cal had that bond. Yeah. Oh my gosh. So we're at Universal, not yesterday, but like a month ago, we were at Universal. And he had Cal and I had Bert. And he was just working Cal.
Yeah, first time.
First time working Cal like that out in public. And he has them and he's sitting over in the Harry Potter area and Cal's doing deep pressure therapy. And some guy comes up to him and he goes, that bond that you and him have is just amazing. Magical. It's magical. And I'm like, the hell? What about the bond Bert and I have? But we were in the bathroom, so he didn't get to see our magical bond.
He would have said the same thing.
So I give Jamie a hard time about that all the time. Not you and Ollie either. It's you and Cal.
Me and Cal. Yeah.
All right. But yeah, so we want to use logic with this stuff too. What if your dog really is trying to get to you? Well, it's just they're really trying to get to you, and we have to keep that in mind too. If one of my tasks for my dog is to go get help, it would be go get Rich or go get Luke or go get Jamie, go get Sam, go get somebody who's here, right? It's not going to be just go find a rando and tell them I need help. That's what an Apple Watch is for. It has fall alert on it, right? What if the dog can't get to them? What if they're at work 12 hours a day, away from here? Then that'd be a silly task. What if they're here, but they're back in the RVs and the dog has to jump the fence? That's not going to happen either. So what if we teach a bark alert? Well, now you have a dog who thinks barking is okay, and a barking dog is going to be seen as an aggressive dog and a pain in the butt. Will sometimes it work? Yes, some dogs need a bark alert. But we have to think, is this the best that we can do? What if we train the dog, or what if it's because we're passing out and we just use an Apple Watch? Well, I don't want an ambulance coming. I don't want an ambulance coming either. When I pass out, I don't need the ambulance to be here. I'm probably going to be fine. So if I know I'm going to pass out, my watch comes off because I don't want to ruin it. But I don't worry about that task. That's not one that I pick that I need. Because I want to have that independence too. I want my dog to be there with me. But when I pass out, it looks like I'm having a seizure and I thrash. So if you ever see that, it's not a seizure. It's just passing out. So I personally don't want my dog laying across me, like I know Sam's done for a few clients, because I'm thrashy.
Right.
So my dogs are taught to lay either beside me or stand there. Sit there, stand there, or lay beside me, but not lay on top of me until I need them and I call them over whenever I'm coming back to it to help reorient me. Remember, I passed out in the kitchen once and I woke up and Gypsy's just standing there looking at me.
Yeah.
Okay. So that helps because it gives you something to focus on. Because if I pass out and I wake up and I see this floor, I don't think, okay, I'm in the bedroom. We're good. I see this floor and I'm like, what is that? That's a floor. Okay. What's today? What just happened? You know, even the stupid, just because of TV and movies and stuff, like, who's the president? What year is this? I have no idea. It's a hard reboot.
Right. You have to be reoriented, and that dog will help you, too, because if the dog's there, it's like, oh, I know what kind of...
I know what this is. It might not click that this is Bert,
right.
You know, or that was Gypsy, but it'll be like, okay, cool. I've got something here, and it's that tactile, right? Mm-hmm. So you can see it, you can hear it. If they're licking you, you can feel it, and you're getting that sensory. And then instead of freaking out because you don't know where this floor is from or what that white thing is right there, it's a whelping box. But, you know, you have that dog that you can focus on. And it helps a lot. I like that. So, you know, you have to figure what task. Which is
with your, with the POTS and feeling wonky or passing out, did you use any scent work with Bert on that?
I didn't because the first Malinois I had, Arrow, we did scent with him.
Yeah.
Because I wanted.
Yeah.
And he would launch at me from across the room. And because he would come into deep pressure therapy. So he would run and just launch onto me, like if I'm sitting on a chair or whatever. And I didn't like that. Like, it didn't matter if I was playing on the computer. Boom, he was right there. Okay. And I was like, this is annoying.
So it did work, though.
It did work. Oh, yeah. Okay. Yeah. So, but I'll warn people too, you know, like, make sure you want it.
Yeah.
Because then if I'm just feeling bad,
right,
he's still like up my butt the whole time. And I'm like, leave me alone. So if you're doing it, you need to have that, thank you. You go do what you need to do and I will take care of myself. And it can't just be the whole like, go lie down, I'm fine. Because the dog's going to be like, oh, no, you're not. And you're not doing what you need to do. And if you discourage it too much, the dog's going to stop doing it. Because he's going to be like, well, then pass out, see if I care. So, you know, with Bert, you know, I didn't encourage the scent stuff too much until we decided to start doing the scent stuff. But he also, we got him at, I don't know, 6 or 7 weeks old. And I didn't really work with him until he was over 4 months old. Okay. Like Luke did.
Yeah.
Because I was like, here, he's your dog. Work him, train him. Like he'd be a little bit annoying. And I'm like, here, do something with your dog. And then I was like, we took him to get his prelims done. And I took him. I was like, he's a pretty cool dog. Yeah. You know, like Luke had done a good job. Like he'd spin and twirl and like he knew some little tricks and stuff at 4 months. And I was like, okay. I'm like, Luke, I think I'm going to steal your dog. Mm-hmm. And I had stole Arrow from Rich. So I like to steal dogs to be my service dogs. Not that you need to be worried or anything, Jamie, but like Ollie is a nice size for mobility for me.
He is. So we've been working on mobility.
Yeah, I didn't tell you there was an ulterior motive for that. But yeah, so we've done it, but we just have to like I said, it can't be the whole like, no, go away. It has to be thank you. I'm going to do what I need to do.
Well, that's another good point too, is because if it is a blood sugar thing or whatever the case may be, how they're picking up that scent, if it's happening 5 times a day or something, it may get to a point where it's just too much for the person, then they are kind of shoving the dog off and like, hey, stop bothering me.
Yeah. So or I'm busy playing a video game or working on homework or whatever.
So you got to be really, to teach that, you have to be committed to every time that it happens. You have to, yes or no.
Yep. And, well, then you're going to get some dogs, too, who are going to say, like, hey, check your sugar, give me my treat.
Oh, yeah.
Hey, check your sugar, give me my treat. Yeah. Right? Because they're smart. Yeah. So we have that, and we also have, it can take some time. Yes. So most people, now a lot of people have Dexcoms, continuous glucose monitor. Right? And they'll have it, like here or maybe on their side or whatever. And they're getting like instant results. And you can get it like hooked up to your phone so you can read what your blood sugar's at all the time. Right. Sometimes they're wrong. My mom's had to be recalibrated because it was wrong. And so hers was reading really off, which was a little scary, right? So I don't do a lot of diabetic alert dogs anymore because most people go with the continuous, with the Dexcom. But by the time it gets to if you would prick your finger, it might be a couple minutes before it's reading down there. Right. So your dog can say, hey, your sugar's low, and you check and you're like, it's not technically low, I'm good. Yeah. And what is low? What is it, 99 that they say it should be now? It used to be 120 not too long ago. Like maybe 20 years ago, 120 was the, under 120 is fine.
That's what I remember, yeah.
Right? And now it's like under 99 is fine. So, or it was up high. Like somehow it's shifted.
Yeah.
then you can probably go back and find it, especially it's so funny. My mom had some old, like, I'm going to go on a diet books, and reading some of those, it was so weird, what these different diets were. You can go on the banana diet. But so you have those. So what we look for usually for lows, and we always train the lows first for diabetic, because diabetic lows smell like acetone, like nail polish remover. Mm-hmm. So if you go to the mall and you walk by the nail polish place and you're like, "Whew, that stinks," yeah, that's acetone.
Gotcha.
So,
and that's the dangerous one, right?
Yeah, that's a dangerous one too. That's the one that'll kill you if you get too low. Yeah. The highs smell fruity. Yeah. So most dogs, it's easier to do the highs.
Right.
So sometimes people will say, well, yeah, but I have highs. Like I'm getting up like 300, 500, 700, whatever. But you still have to train the lows first, because what'll happen a lot of times with people who have diabetes is it'll switch, and you'll go from having a bunch of highs to having a bunch of lows. So you have to train the lows first, even if you're like, I never ever get lows. I don't care. We're still going to train the lows first. Yeah. And they all smell the same. So an endocrinologist is a diabetic doctor, a diabetic specialist. And you can talk to your endocrinologist, talk to your GP, and see if they can get you samples. So you can, like, I only have highs, I don't have lows, but my trainer wants me to train lows first.
Right. Do
you have any patients who you think would be open to getting samples for me?
Yeah, that makes sense.
And how do we get the samples? You have a couple different ways to do it. My cheap and easy way to do it is a Q-tip or a swab. And one side of it is going to be spit in your mouth. The other side of it is going to be sweat. Especially this isn't for diabetic, we're switching back and forth. This is more for POTS, or if we don't know what the scent is, we want to do spit and scent together. So we'll do one side spit and the other side sweat. But I can't do it along my hairline because I maybe just use hairspray, or I maybe just put makeup on, or I just put lotion on. So I can't do my armpits because I just put deodorant on. Where are you going to get your scent from? I lotioned up my legs, and it's this really good moisturizer, and it's like a body butter. So, like, you can feel it for a while.
Yeah.
So I don't want to do, like, my knee pits. You could do between boobs. You could do lower back, like the small of your back, where you put a tramp stamp. That might work. If you've, like, broken out into, like, a cold sweat everywhere, POTS, like, stuff. Like, sometimes I'll do that. I still have to watch the arms because perfume and lotion. So think of where would you put it, because when you're not feeling good, you're not going to want to get a sample, and you're going to say, I'll do a sample later. So if you do have a glucometer, which is the blood sugar test kit, they come in little pouches, or you can get a makeup pouch, or join Ipsy and get a bunch of pouches, and then you can choose. But put some sample collection things, everything that you need in there, so you have it. Or make up some test kits, again, Ipsy, or pencil bags. Go to Temu and buy a dozen makeup pouches. And then you can make up kits and put them all over so you can make it as you need to. Because if you're sitting here and you're like, I don't feel good, but the test kit is in the...
That's the last thing I want to do.
Right? But guess what? What if you trained your dog to go get it?
Exactly.
Right?
Yeah.
But we still want to make it easy. We don't want to say, okay, Ollie, you need to open up that door, close it behind you, go find it, open up the drawer, close it, come back, open up the door again, and close.
Yeah.
It's too much.
Yeah.
Just like if your test kit has meds in it, because it should, right?
Sure.
It's probably going to have some sort of meds in it, even electrolyte in a little water, right? For POTS. But you don't want to, I'm going to teach him to go get a drink from the fridge. You really want him to help yourself to the steaks you're going to cook tonight?
Exactly. Yeah.
So we'll put the water in there. Do I like cold water from the fridge? Yes. And ice. Would I drink room temperature water to take meds because I need to? Yeah, I will. If I really wanted, get me a cold drink from the fridge, I would train it not with my normal fridge. I would train it with a dorm fridge, right? Because you could take the little handle off of that. So it's things to think about, because oftentimes when we talk to some owner trainers and professional trainers who think that I can train some of these things, it'll be so easy. They want to do things like, I want to train them to open up my main fridge.
Yeah, that's like one of the main things people want. Open up cabinets, open up the fridge.
Right? Push the button for the handicapped.
Yeah.
And there's not a lot of buttons out there. It's push. There's a few, but there's not. There's very few and far between for the places that I go to, because I notice them. I do. So spit and sweat on either side of the swab. You put it in a snack size Ziploc baggie, not Walmart special. Ziploc, go with a name brand. If you can go freezer, go freezer, right? You also are going to want to have masking tape or address labels. And you can pre-write out some of this, and you need to write on it the date and what it is. So if this was a diabetic sample, I could put down that it was whatever today's date is, month, day, year, and that it was 70. It was 50. It was 130. You know, like I put down what it is, and then I'm going to take that in the sealed Ziploc, labeled, and I'm going to put it in the back of my freezer. I'm going to have a quart-sized mason jar, and I'm going to pop it in there. Now, if I just took this swab, and I didn't label it and put it in a bag, and I popped it in the mason jar, that's stupid. Don't do that.
Right. Because you don't know.
You don't know what it is. Why? What is this? I'm going to write it on there. Like on the little stick between the swab. No, you're not going to do that. Don't do that. Don't do that. It has to go in the Ziploc. It has to. One of the things that we bought in bulk were, if you're watching it, you're going to see dental cotton, which I don't have, and that's cotton that would fit in here and like fill it up, right? Or if you go to the dentist and they put cotton in your mouth and you're like, bleh, afterwards, that's dental cotton. Okay. That is going to take a lot to saturate. Yeah. So if you think you're going to take a spit sample, don't swallow your spit for a while. You know, while you're prepping it or like while you're checking your glucometer, just don't swallow. Right. And then, you know, you're like, it's going to fall out. And then you pop it in there and it's going to soak it up.
That makes sense.
You can also cut out your cotton, your dental cotton if you're using it. What if you cut it into like quarters or thirds or hundredths? Like you can have it and then you can have multiple ones in, like I've got 4 samples in here, or you can do 4 separate containers. But this was nice because you can pop that top off pretty easy. Yeah. For real, it's easy. There we go. You pop the top off, and then you can kind of roll it out, because here's the gross thing is, no, this is just a scent swab. This isn't spit. This is like birch or something. Yeah. But if it's spit, I don't want to touch your spit. It's gross. And if you're doing diabetic or any scent-based medical, one of the things trainers will tell you is now you rub that spit, that other person's spit on you. Yeah,
so that you...
Ew, no, I'm not rubbing someone else's spit on. I don't want Rich's spit on me. I don't want anybody's spit on me. I don't want my spit on me. Like, no, I'm not rubbing someone else's spit on me. That's where these come in. This is a metal circle tin with holes punched in the top. And you can see we punched them because they're not even. There's a metal hole punchy thing. I don't know if you can open that or not. They'll eventually rust together and you're not going to be able to use it forever.
Top or is it twist?
Both. I think it's pop. And then magnets. So these are, I think I got these years ago at Hobby Lobby. They're the strongest magnet I could find. And I mean, I'm sure with the internet and stuff, I could probably find stronger now, but I don't remember what this was, but they're pretty strong magnets. So I could take it, and I usually just keep a magnet in the tin. Well, I can open the tins. Yeah. I'll keep the magnet in there, and then I can pop that tin wherever. So if we're going to go, like we went to Universal yesterday, I could have that in my pocket. Now, if that had diabetic low on it, and I was training the dog and it was just in my pocket for the whole day, the dog's going to learn to ignore it. So what do? We can use a quart-sized Ziploc and have it maybe in a little cooler. Or maybe I won't even use that. Maybe I'll use like this little plastic doohickey and have it in a Ziploc, put it in my pocket, and then pull it out of my pocket, unziplock it. Maybe I'll tuck it into my sock. Maybe I'll tuck it up my sleeve. Maybe I'll tuck it, yay for bras, right, in my bra strap. Maybe I'll tuck it in my waistband or put it in my pocket. Are you wearing jeans or are you wearing mesh shorts? One's going to be easier for the dog to smell through, right? And then maybe we'll do where the dog's like, oh, wait a minute. Like, it's thawed. I smell something in your pocket. And you're like, cool. And then you chuck it. Or you put it back in the Ziploc and do it 1 or 2 more times and then you chuck it. Like, you have to know when you're introducing the scent so the dog does good with it. Right? You don't want him to be like, yeah, you always smell like that. Yeah. It's not a big deal. But where does it start? At 3 days old, we're teaching the dog that scent has meaning. Scent has meaning. You smell different today. Mm-hmm. You look different today. Yeah. And it's not just because you're wearing a different hat. There's something like I want to know what it is. Like your pupils are more dilated and the dog might be like, that always happens because of classical conditioning before this happens. Right. So therefore, I'm going to watch whenever that happens and let you know so you can take measures to prevent.
Sure. Yep. Boom, boom. Makes sense.
This is birch, And you see we have it. We have birch, anise, clove. I think there's another one. But we have them in their baggies with the dropper. Because the topper, this is from Learberg. This annoys me. I got the 1 ounce and I got the dropper. The dropper doesn't fit on there.
Oh, really?
Yeah, it's really annoying. So I think I need to go on Temu and order and just re-bottle all of them because this is a frustration and annoyance to me.
Yeah, okay.
Yeah, so I got them so we make up our own. I don't just buy the swabs. I lied. I buy the swabs. I make up our own. We'll cut the swabs in half and put them in like a little mason jelly jar.
Yep.
And then we'll add in a drop or two of the scent and we'll let it soak in the scent for a little bit. So then we can take the swabs out, we use them, and once you're out and you use them for birch, for AKC scent work, or, you know, diabetic stuff, they're contaminated and you can't reuse them all the time. So how long do samples last? We will tell you, we don't know because we're not dogs, but what they say is 3 months in the freezer, 3 days in the fridge. For the diabetic samples, it's so gross. They start getting moldy about day 2.5.
Oh, gosh.
Like visible molding. So some people will take it out of the freezer, let it thaw for 5 or 10 minutes, use it with the dog, and then put it back in the freezer. And I'm like, but it's still contaminated.
Right.
You know, so we'll pull it, we'll use it for a 1.5 to 2 days max. And it'll be in there. See, you and Jamie can't open it.
I can't get it. I think it's glued shut.
Right? It was glued shut. That was a trick. Gorilla glue for the window. I'm kidding. Yeah, it just happens. You can see there's some rust on it too.
Yeah.
So that's why we'll get a bunch of them. Amazon or like I said, I'm sure Temu would have it too, because they only last so long. And then if I use this for diabetic, I can't go and use this for pots because it's contaminated, right? Yeah. So I could label the back of it. I have a nice little label maker now, so we could print up labels for everything. But we could label it, or we just chuck it and we do the other one. Because if it saves, even if it's $2, I don't think they're $2. But say they're $2, but like you're training a service dog, so spend $100 on new tins if you need to. Yeah. You know, but yeah. So what we'll do is we'll take the tin, and the scent stays in there because, like I said, I don't want to touch somebody else's spit, and we will put it in a Tupperware. A sealed Tupperware, not like a janky thing that had, you know, like what the Hormel lunch meat in it. Like, we'll get the one with the rubber seal with the clip down sides, a small one, like the stupid ones that you get in the kit, and you're like, I don't know what to do with this. Like, nothing is this small. This is stupid. Yeah. It's perfect for these. Yeah. And that's in there. And we might label it, you know, Monday, January 1st. Right. You know, and then we know that on January 3rd, we need to replace it. So then we could cross out and put January 3rd. So we know how old the scent sample is. Because we need it. Now, if I'm doing a dog and I have a dog for 30 days and they bring me 30 scent samples, I'm golden. Because if I'm going to work the dog every day, I've got a fresh scent sample that I can use every day. And I don't have to put it back in the fridge, in the mason jar, because I don't want it sucking up the onion that's diced in there. You know, you don't want that. But like I said, everyone has their own little... and you could do one dog and say, oh, this is how you have to do every dog, but it's not. Mm-hmm. You know, sometimes the dogs love it. We had one, this still, I remember, it still breaks my heart a bit. And I just told you about it, but I didn't tell them about it. So you get to hear it again. Okay. It was a pointer owned by a veterinarian. And she wanted the dog to be a diabetic alert dog for her teenage daughter. Mm-hmm. And the dog came in for board and train. The dog wanted nothing to do with scent. The dog wanted to trim my chickens, so I lied. He liked scent for that. Yeah. He didn't want it for, here's the scent, touch it, or here's the scent paw, or here's the scent, let me know. And I also don't do a paw alert usually. Usually it's a nose boop, because I don't need the dog raking his nails down my leg. It's annoying. The dog wanted nothing to do with it. The dog did not want to be out in public. The dog did not want to be a service dog, and they have to want to do it. Yeah. It has to be something that they enjoy doing. He would much rather trim my chickens around the yard. And I told the owner, like, he does not want to be a service dog. And she's like, well, he will. They would go out into the Gulf of Mexico on a boat, a couple hours, out into the Gulf. And the daughter liked to swim. Well, what did we just find out about diabetics and exercise? Exercise will lower your blood sugar. So if you do have highs, what did I tell you to do? Go for a walk. Yeah. And you just have to wait it out. So that's two, where the lows are going to kill you. The highs, it just takes time for it to come down. Right. So the dog's like, hey, I told you were high. I'm still telling you you're high. I'm still telling you you're high. And you're like, dude, all I can do is go for a walk. I'm still walking. Yeah. So that's where the lows are more important. But I'm not going to trust my daughter to the dog who doesn't want to do it. Right. 2 hours off of the coast. I don't know how far helicopters go. If a helicopter could go out and get her, but hopefully she got a Dexcom and has stuff just in case.
Sure. Yeah.
Because it's scary.
It is.
And while I don't do a lot, there's a trainer in Texas, Adam Gibson, and that's who I recommend if someone's asking specifically for diabetic alert dog training.
Oh, okay.
Talk to him. And then someone was like, oh, because he teaches some workshops and all. And another trainer was like, oh, but he only works with local people. And I said, I don't care. I said, then maybe he knows people who can recommend a diabetic alert dog trainer closer, or maybe that'll encourage him to put together some sort of virtual program. But that's his specialty. So just like I would hope if he'd get a POTS dog, he'd be like, talk to Vicky.
Right.
Like I'm going to send where that's what they do. That's what they excel in.
Yep.
And if we go to conference next year, I think he's doing something.
Oh, good. Okay.
So, for IACP, because it's in Texas next year, or this year.
One of the other scent, practice things that we would do is like a PVC pipe and have a scent inside of it.
Yeah.
And have the dog, as long as it's in the dog's mouth, he's good. He's having fun. He's playing. Once it came out of the mouth, everything stops until it goes back in the mouth.
Okay.
That was more for the police dogs, just getting that scent just wafting through their mouths and their nose, I guess. Is that something we do at all?
We used to.
Okay.
Rich would make, what did he call them? Food bombs?
Yeah.
So you could either do it with small holes for scent bombs were the scent ones. Food bombs had bigger holes that the food could come through, kind of like a wobbler.
Yeah, okay.
Right? So we did both of them with all the different fittings and all, and he'd get his drill out, and he'd have so much fun doing all these. But I have some questions about it. Mm-hmm. One of the things, if the dog is panting, they're not smelling. So what Bart would say, and it's a gross analogy, but it really gets the point in, is if you go into a stinky bathroom, you're going to breathe through your mouth, not your nose, because you don't want to smell it.
Yep.
So I don't know how much scent they're getting through their mouth.
Yeah.
And then we know when we're doing scent work with the boys, we want the mouth closed.
Right.
Because if they're open mouth panting, we know that they could be fake looking for it with their eyes, but they're not using their nose. And they'll close their mouth, and then they'll find it because they're using their nose fully. So I don't know how feasible it is versus it looks like it.
Yeah.
What I would recommend doing, and we've done this before, is we've soaked toys in the scent. Oh. That doesn't mean here's a bath of birch, right? But if we have, say, a birch spot, we've done actually with gluten, because we got Vital Wheat gluten and soaked some toys in it, and then played with the dog with these toys. And soaked means just we take a shoebox, we put some Vital Wheat gluten in there, put a drop or two of birch, or some of the scent, maybe put a couple scent swabs from pots in this shoebox, plastic shoebox, not like what you just got your Adidas in, and clip it and just let that scent soak.
Yeah.
Right? Yeah. So that could be, we did some of those bar towels. Yeah. For the dog. We had taken some toys that we could throw in the wash if need be to clear it out. And it's going to be more fabric toys. I don't know how much a Chuck-It ball or a Kong, a red Kong, would absorb the odor.
Yeah.
You could try it and see, because they have their own odor too that you need to proof off of.
Right.
But do that and then play with that. So that means good things happen. But again, you're diabetic or you're going to pass out. Do you want your dog jump up on you and say hey, it's time to play? I know that smell.
Or putting your mouth on you because it.
Yeah, because you smell like my favorite toy. I'm going to bite you.
Yeah, makes sense.
So I've seen it, and I've seen it. I had a friend who was telling me that she was doing it with her dog. Having him carry this scent stick, with the holes in it through the neighborhood on walks. But I'm but I don't know what he's doing out of it.
That's a good point.
I think you'd have to do some trials and see, okay, these dogs are all about the same level. Half of them we're going to do normal, like how we always do, and half of them we're going to have them carry this, and we're going to see if it makes any difference.
Right.
Or if it just looks cool.
Yeah.
At least dogs that like to look cool.
Yeah, I think that's part of it for sure. Because you can get good pictures of it. So
yeah, you can.
Yeah.
Right? Yeah. But yeah, so we can do that with the toys, with the scent soaking.
Okay.
And get them scent has meaning, right? This toy means something awesome, but it would have to really be a specific situation. Like I said, this one dog, it was a that we had done the Vital Wheat gluten with was a Vizsla. And she didn't really care to use her nose for that, but she wanted to, the owner needed that gluten detection, and she wasn't getting the scent part of it, but she liked to play.
Yeah.
So we take some of those bar towels, we put them on the end of a fork pole, and we get her playing that way with it, because Vizsla, right? Hunting dog movement. Mm-hmm. And she really enjoed that.
Yeah.
And for her, it clicked. You can ask Tara, too, because Tara was here whenever we were doing. Maui was the dog.
Oh, yeah.
But yeah, so that worked out good. And yeah, and you do have to watch that contamination. Mm-hmm. We don't want to contaminate. So if we're training with the metal tins, right, then we need to trim metal tins with scent, metal tins without scent, because we don't want him saying, it's a metal tin, I know what that means.
Right.
So that's why we use the metal, we use plastic. We'll sometimes just take one of those snack-sized Ziplocs and open it, you know, depending on what it is, because I'm not touching other people's spit with my hands or putting it on me. But if we're doing the birch, we'll just take the Q-tips and we'll like hide Q-tips. And then we'll go and pick them up afterwards, or we'll put masking tape and tape them onto places. Or we have pieces, I have a little kit in the car. We have straws, and we've cut up straws, so we could put the straw, put the Q-tip in the straw and then pop that somewhere. You know, what else can we do? And then it's contaminated, so I can't reuse it. So then they go right in the garbage. So we need to stick little Ziplocs in there. So we have for the contaminated ones, because then I can't walk around. Say Jamie has Bert or Ollie. Jamie has one of the dogs, and I go and I hide 5 things of scent in the park, right? And he's going around, and the dog's finding it, he puts it in his coat pocket. That's not going to help. Because then he's going to smell like 5 times birch, and the dog's going to be like, it's in your pocket. I found it. So we'll do that, and we'll chuck it. And then teaching Bert, too, as we're getting to the more advanced levels in scent, there could be 2 hides. There could be a birch and an anise.
Exactly.
So he can't keep coming back and saying, it's right here. I'm telling you it's right here. Like, okay, thank you. I know it's there. Where's the other one?
Right.
So you kind of want that depending on what you're doing.
Yes. Yeah.
What else you got?
Makes sense. I know you and I have talked about this and kind of on our own, but those ball launchers, we would use those too. We'd have like 3 or 4 of them lined up, boxes, and then the scent in those. And I think really the differentiator between the police dog work and the service dog work is that they're not getting any treats or food. It's all play. It's all play. So I don't know. We haven't used one of those here, but I saw how effective it was there. Is that something y'all have tried at all?
We hosted one of the police canine trainers in Gainesville to come out and do a scent workshop years ago when we were in Gainesville. Mm-hmm. And he came out and he brought his ball launcher.
Yeah.
That noise, that's...
Oh, is that her?
Yeah, that's either I'm getting more comfortable or I'm not comfortable. Yeah. No, she has had puppies. I'll show you what's going on. Lucy's over here. That's Rich's comfy chair. And she's had puppies on that chair before. So that grunting, yeah, that could be a sign. There's a reason we're back here today. And it's not just because I want you to watch the fan in the mirror. So the ball launcher is really cool. We looked into getting one after that, but they're about $700 or $800. But that was like 10 plus years ago.
Yeah.
So it might be a different price now. I don't, though, want the dog to just check the boxes. Like, most of the time with the service dogs, the scent's on us. So them checking boxes and telling me which one has it for that ball to launch. And he basically hit like a key fob, and it goes bing, and it comes up, and the dog's like, hell yeah, you know, like, because it's coming directly from the source. So there's obedience to odor, and then there's, so like, is it here? So if the dog's like, it's right here, I know it's right here. So if you're teaching a really good indicator, that would be really good. And then boing, it comes up, and the dog's like, hell yeah. We don't need that as much with what we're doing. They also have scent walls, which are really cool. They're what is that game? Do you remember from Price is Right, where you like
Plinko thing?
No, you'd like reach in, you'd like be able to punch the like 5 different things, and then they reach in. That's what it reminds me of.
Yeah, it is.
Plinko's fun.
You're right.
But yeah, so you have that, but most of the stuff isn't on the wall. It's not in the box. Mm-hmm. You know, we did box work today, so like that's box, but it's a little different. But the big thing was that. So if we are good with our markers, which we start teaching the dogs when their ears open, we start with the clicker. Yeah. So about 3 or 4 weeks old, these dogs are learning the markers that we use. So if we can mark while they're indicating, even for Bert, Janice, Chloe, for AKC scent work, right? If we mark there, and then we reward, you know, as long as we don't classically condition that boing, and I'm back at you and give me my food or give me my toy.
Right.
And the food often lower a dog's drive, stabilize a dog's drive, right? Whereas a toy will ramp it up.
Yeah. Yeah.
So we can ramp up because a lot of the dogs who are police dogs, I'm not an expert on them, but I've trained enough with NEPO stuff that like I get a lot of it. A lot of them are these high octane Malinois and Shepherds and dogs that are just crazy, and they want to keep making them crazier, and then people don't understand that even the general public, that like they really watch these dogs. Like when they do outings and demos, the dog gets out there, does the demo, and gets off. Like you don't go up and pet those dogs. Right. You don't go up and love on those dogs. Yeah. And if their handler can, that doesn't mean you, the general public, can. Right. You know, I think it would benefit them more to bring in some markers and impulse control for the dogs. So the dogs are just a little bit not as cray-cray.
Yeah, I think you make a good point there. Because that ball launcher thing immediately ramps them up. Like, they go from 0 to 100. And if you had a little kid nearby or something, you don't necessarily want that with our dogs, right?
Right, so, but they're also not usually at Universal, you know, looking for it. And they're not, you know, they're in drug warehouses. Yeah. Exactly. They're like, where's the good stuff? Yeah. But yeah, no, it's a great thing and it's a great tool, you know, to have and to have something that, okay, like what if that pointer who didn't want to do it, what if he was Ball or Maui liked to play? Like something like that could have helped click for them. So if anyone wants to donate a ball launcher to Hope Service Dogs, we are a 501c3 nonprofit. And we are happy to do a receipt donation for you.
Cool. Yeah, I love to work with it. Yeah.
They're fun. I mean, I'm not saying they're not fun. And you do need to have multiple of them. You can't just have one because the dog's like, it's right here. Yeah. You need to have, I mean, I'd say at least 3 to get started. 6 would be more ideal. But I don't know if they all have to have the launcher in it. But the dog's might be able to smell like, hey, this has like the oil in it that makes the mechanism go. Right. You know, I don't know. Yeah. This one smells like ball. Ball is life.
Exactly.
Ball. You got any other questions?
No, we covered a lot.
We did, right? So Jamie, we were talking about this the other day, and I said, let's do this for the podcast. And he was like, okay, I'll write up a list of questions. And then, like, every day since then, I'm like, you ready to do that podcast? And he's like, no, I need to work on my list of questions.
That was only one day. It wasn't every day.
It was like every day for the last 2 days. And so see, it was every day. And then yesterday, when we got back from Universal, we were both just done. Yeah. But I told him I like to swing by the seat of my pants. So we just, you want to do it now? And he's like, no, but okay. You might have to edit it. I'm like, it'll be live on Facebook. It's okay. So you were a good sport for it, Jamie. You were a great contribution. You had a lot of good stuff. Because if it's just me rambling, they get that a lot anyway. Okay. And I try not to ramble too much.
No, it was fun.
And you kept me on track.
So that was good. Me. Yeah.
Perfect. So for more information, check out Hope Service Dogs. Our link tree is liktr.ee/hope, HOPESD for service dog. Our website is hopeservicedogs.org, and you can find us there. You can find us on Instagram and Facebook and the TikToks and the YouTubes. We've got different channels for different things, which is why Linktree is nice. Jamie is starting up his own. If you're in Central Florida, or if you're not in Central Florida and you want to work with him, reach out. His email, if you're ready for it, is james@hopeservicedogs.org. Yep. You know, or you can message us through the site and I can get you guys in touch. But yeah, and he's working on starting up all his businessy stuff.
Yep.
So
I'm in between here and east coast of Florida, so I can kind of cover.
And sometimes in Birmingham area.
Yep. Sometimes in Birmingham. Yep.
So your dog will get a huge experience working with him because he does travel around. What is it with people who travel coming and staying here for part-time? Yeah. But we are trying to talk him into moving here. He stopped looking at houses, though, so I'm sad.
That's not true. I'm back on it.
Okay. But we have Puppy Watch, so we're going to go, and we will catch you guys next time. Bye.